The cheek retractor that we use, you'll notice that there's a tab here. The tab goes towards the tongue, so that's going to hold the tongue back so that we can isolate properly. I like to kind of push it together, have the patient open as big as they can, good job, and then kind of slide their lips around there, make sure they're seated into the plastic, and then we've got like a little isolated area, and you just have them put their tongue behind that tab. Perfect. Okay, so now we're going to get started with our attachments. I'm looking at my attachment sheet here, and we have 6 attachments on the lower arch and 8 attachments on the upper arch. The first thing that I like to do is turn off the room light so we have more working time with the composite. I like to place all the attachments in one arch at one time, so this allows us more working time to fill the template. Make sure to isolate with cotton rolls to protect your patient's lip from the etch. One of the biggest issues that we have is cleanup. When I'm etching, I like to avoid the gingival and incisal thirds of the teeth because this is where you typically get excess bonding that will interfere with the integrity of the aligner and cause plaque and stain buildup. If we look at the attachment template or at the attachment sheet for Tiffany, we'll notice that she has 2 attachments on tooth number 8. Instead of etching the entire tooth, I'm going to look at where those 2 attachments are and etch only those specific areas on the teeth. This is going to make cleanup much easier, but more importantly, will improve the fit of the aligners and your patient's tracking. Continue etching all the teeth in the arch. Once you've etched all the teeth in the arch, let the etch sit for 20 seconds. Then use a surgical suction to remove the bulk of the etch. This helps to prevent the patient from swallowing any of the bitter tasting etch. Now rinse completely with water. Use your surgical suction to remove any remaining etch off of the teeth and air dry completely so the teeth are dry. Apply your bonding agent in a thin layer. Because we have avoided etching the incisal and gingival thirds of the teeth, you're less likely to end up getting excess flash after curing or have issues with occlusal interference on the excess bond. Once you've applied your bonding agent to all the desired teeth, air thin and cure each tooth for 10 to 15 seconds. Make sure to remove any debris in your attachment template or any moisture, as this will interfere in proper attachment bonding. Use a flowable resin composite to fill your attachment well. Make sure you're filling from the bottom of the well and back filling to avoid getting any kind of bubbles or voids. I'm using G-aenial Flo flowable composite, but you can use any flowable composite of your choice. Notice how the tip of the flowable is going to the bottom of the well and then coming out backwards to avoid any bubbles or voids. Work your way across the arch, filling every well on the template. Insert the aligner and line it up with landmarks. The canines or the centrals are usually easy to use. Seat the aligner completely using finger pressure, double checking that the posterior aspect is fully seated. Once fully seated, you can take your curing light and cure each tooth for 20 seconds. Once you're done curing, remove the cheek retractors. Now remove the attachment template. I find it easiest to use an explorer or scaler to gently release the template from the teeth. Make sure to be careful not to distort or tear the template in case you need to replace an attachment in the future. Occasionally, you will have an attachment that doesn't bond to the tooth and comes out with the template. If this happens, remove the attachment gently from the template using an instrument. Clean and thoroughly dry your template, and then repeat the previous steps, but only on the tooth where the attachment didn't bond. This usually occurs if there is an isolation failure. We're removing the lower template now using the same technique as we did on the upper arch. The remaining excess bonding agent should be easy to clean up with a sharp scaler if we didn't over etch the teeth. Typically, when a patient says that they feel something when they bite together, it's right here on the incisal third of the lower premolars and canines. Make sure to check the gingival third as well, as sometimes bond can accumulate in that area, causing an issue with aligner tracking as well as oral hygiene. Ask your patient to bite together and see if they feel anything interfering with their bite. They're usually able to point directly to where there is some excess bonding agent. So I can check right where the patient is feeling it, and there's a little piece here that just pops right off, and we clean that up really easily. So you want to make sure you can floss every contact before the patient leaves to remove any excess bonding agent that may have gotten stuck in between. If you can't get the floss through, you can get either a serrated strip or some kind of quick strip with a saw on it to get in between the contact and just knock out any residual bonding. If you don't feel like you got all of the excess bonding agent off, you can use a high-speed handpiece and a finishing burr of your choice to just clean up around the attachment. It's really important you want to avoid the actual attachment itself because you don't want to distort the shape of that. Most attachments we use in Invisalign now are optimized attachments, and they have a specific way that they fit into the tray so that movements will be expressed fully.